Ladies and gentlemen. Welcome to our webinar. We are delighted to have you here as we discuss healthcare waste management practices in Korea and elsewhere in the context of COVID-19. My name is Sarwat Chaudhry. I am the Environment Team Leader at the UNDP Seoul Policy Center, and it's my great pleasure to moderate today's webinar. This is the second session of our center's environment focus webinars. Looking into building back better, we are exploring whether the response to COVID-19 can be a catalyst for positive change for both for people and the planet in parallel. We hope to use this opportunity to discuss and provide examples of various practices, innovative ideas, challenges, and opportunities that are relevant in Korea and elsewhere in the world. Before I go any further, as it is our practice, I would like to invite all participants to please enter in the chat room your name, if you wish, and your current location. So please add your name, current city, and country. We have already have 138, 140 people registered for the webinar. So I know you are connected from around the world, but we'd really like to know where you are located. And since we are a global policy center based in Korea, sharing your locations along with your name will give us a sense of the participants and also reinforce our sense of global solidarity. Let me also mention some housekeeping points. This webinar will be about an hour long, so we have limited time, but we do hope that we will have a stimulating exchange, which can follow up later on bilaterally with emails and also other web-based meetings. Also, this webinar will be recorded and will be made available to all participants. The PowerPoints will be uploaded in our website and after the webinar. So given the restrictions of the time today, please note that we will be taking questions from the audience through the chat room only. Therefore, please feel free to start asking your questions on the chat box. To go back my previous point, if you haven't done so already, please start your question by stating your current city or current location. So now I invite Dr. Stefan Klingabil, Director of the Seoul Policy Center. Over to you, Stefan.
Thank you, Sarwat. Dear Dr. Yoo Kim, Ms. Xiaofang Zhu, and Dr. Ute Pieper, and distinguished participants. As the director of the center, I'm very happy to host this webinar. The Seoul Policy Center has the mandate to broker knowledge and partnerships between the Republic of Korea and the rest of the world. COVID-19 has become an extremely serious global health crisis, overwhelming healthcare symptoms around the world. The healthcare response to COVID-19 requires both competent and swift action from governments and healthcare authorities. It is well known that the Republic of Korea has responded rapidly to the healthcare demands of COVID-19. An important component of that response is managing healthcare waste in a safe and effective manner to avoid secondary infections and environmental contamination. Korea responded quickly to increase healthcare waste management capacity and set up stringent procedures for government facilities and self-isolating individuals at home. Through this webinar, we hope to share Korea's experiences with healthcare waste management during COVID-19, along with global perspectives on the subject. We believe that sharing these experiences during this rapidly changing context of COVID-19 would be significant for many UNDP country offices and partners as we all go through this challenging time. I'm very pleased that we have participants from so many countries today, from Africa, Europe, Middle East, Americas, and Asia. I would like to extend special welcome to our partner country office colleagues, as well as government officials who have joined this UNDP webinar for the first time. Let me provide some quick facts about the center, the UNDP Seoul Policy Center, which was established in 2011. In the last 5 years, our center has been active on various green issues, sharing and exchanging knowledge on Korea's innovative practices on sustainable energy, energy efficiency, waste and wastewater management, recognizing the importance of environmental policy in the achievement of the SDGs. Focusing on resilience, we now have a rich portfolio on sustainable forestry. We have worked directly with countries such as Ghana, Myanmar, Tajikistan, Bangladesh, Indonesia, and Mongolia in this context. Now it is my great pleasure and honor to welcome our speakers for today. First, we have a presentation from Dr. Yoo Kim. Dr. Kim is a medical waste management expert from Korea Environment Corporation, an organization affiliated with the Korea's Ministry of Environment. Dr. Kim oversees government policy support for medical waste management, including healthcare waste disposal and on-site technical support for disposal companies. Second, we have Ms. Xiaofang Zhu, who is the director for the Montreal Protocol and Chemicals Unit at UNDP. This will be followed by a presentation from Dr. Ute Pieper. Dr. Pieper has over 15 years of professional experience in the field of environmental health and has worked on healthcare waste management projects that have been implemented in some 40 countries. Currently, she's working with WHO and UNDP on their global healthcare waste response during COVID-19. Let me now invite Dr. Kim to start his presentation. Please, Dr. Kim, you have the floor.
Hello, my name is Junho Kim.
You're unmuted. You need to unmute, Dr. Kim.
Yeah. Hello.
We can hear you now, so you may start now, please.
Yes. Hello.
Yes, we can hear you well.
Yes. Hello, my name is Junho Kim, and I am a member of the RFID operation team of Korea Environment Corporation in charge of medical waste management. Through this online platform, it's an honor to have this opportunity today to give you an overview of Korea's effort in the fight against the COVID-19, specifically in medical waste management. Today, I will outline Korea's medical waste management system and the special medical waste management measure implemented in our response to the coronavirus pandemic. I will also discuss the rules and endeavors of Korea Environment Corporation, as well as something I'm sure most of you are curious about, which is Korea's special management facility for our coronavirus response. Before talking about medical waste management in Korea, I would like to introduce the Environment Corporation brief. As a quasi government agency under Korea's Ministry of Environment, K-ECO's mission is to contribute to eco-friendly nation development through the improvement of environment conditions and the facilitation of resource circulation. Our main headquarters is located in Incheon, and there are 6 regional offices with approximately 3,000 staff nationwide. Most of them are engineers specializing in environment-related topics. Korea's medical waste classification system divides medical waste into 8 categories for measurement. Medical waste products during the isolation of patients with contagious disease such as coronavirus, placenta waste for recycling, waste such as needles, pathological waste, biological waste, blood contaminated waste, and general waste such as bandages and gauze. A radio frequency identification based processing system and that enables the real-time measurement of entire process of medical waste processing from discharge to transportation and treatment has been in operation since 28. All entitled that discharge, transport, or process medical waste in Korea are required to by law to use this system. Thanks to its RFID-based medical waste system, I believe Korea is on the only country in the world where the real-time monitoring of discharge, transportation, and processing of medical waste take place. This technology is being used by some 9,000 discharge entitled and 186 transportation service providers and 30 incineration service providers. The information that is captured in real time by our RFID-based medical waste management system is provided to the Ministry of Environment and its provincial office and 200 cities for local government. Korea's first confined case of COVID-19 was a Chinese national who entered Korea from Wuhan, China, in January 20. After being identified at the airport quarantine expansion, she was immediately transported to a negative pressure isolation room at a government-designated hospital. Korea Centers for Disease Control and Prevention organized the Central Disease Control Headquarters. They activated the emergency response system by elevating the contagious disease alert level from interest required to caution. 4 days later, a Korea national who entered from China became the second confined case. After pause, case was confined due January 27. The CDC headquarters was upgraded to the Center for emergency operation headed by the Minister of Health and Welfare, and the alert level was promptly elevated from caution to warning. Subsequently, promptly COVID-19 testing was carried out at designated clinics on everyone who had traveled through or Wuhan or were displaying symptoms regardless of nationality. On January 30, the Ministry of Environment permitted a policy on the special management of medical waste. The key stipulation of this policy is the same-day discharge, transportation, and processing of coronavirus-related medical waste to prevent secondary infection. Korea's speed response to the coronavirus outbreak was made possible due to our experience with the MERS outbreak in 2015. However, the most significant difference this time is that the actions 2 weeks were preemptive and not responsive. My organization, Korea Environment Corporation, has been in operation the coronavirus medical waste management briefing room and trust with the operation of the RFID-based medical waste management system since January 28. To ensure medical waste from COVID-19 patient is appropriately treated, the government mandated system of waste or medical waste classification system was expanded from the 8 to 9, giving coronavirus-related medical waste its own category. This new medical waste classification system was implemented immediately, enabling a preemptive response to emergency. During the 2015 MERS outbreak, switching from the 8-type management system to the 9-type management system took about 7 days, but this time the switch only took 2 days, thanks to close cooperation between the related agencies. To date, 400 entitled have discharged coronavirus-related medical waste, including government-designated hospital, screening clinics, community treatment centers, and living facility of the 868 tons of coronavirus-related medical waste generated. 186 tons were incinerated. As Korea Environment Corporation is a government agency dedicated to public service in the environment field, we are focusing our energy on the coronavirus response. To fulfill our role as a public agent, we have dispatched some 30 experts to community treatment centers and temporary living facility to service the wide community. I myself recently returned to my routine duties after working to provide support to Korean nationals who returned to Korea from Wuhan between January 20 and February 17. Now, I'm going to describe the various facilities Korea organized for the first time in our coronavirus response. One of the first measures introduced was the drive-through and walk-through COVID-19 testing facilities. The aim was to test many people as possible, as quickly as possible, while ensuring the safety of the medical personnel. Now I will move on to community treatment centers or further treatment of confined COVID-19 patients that have mild symptoms. Community treatment centers were West Village. After there, with rapid increases of COVID-19 patients in the Gyeongsang-Bukdo region and Daegu City, there were reports of patients with seeming mild symptoms having died at home due to a shortage of hospital beds. To ensure this does not happen again, a support team of medical personnel is now permanently stationed at the community treatment centers for treating patients with mild case of COVID-19. Second are temporary living facility for the self-isolation of people entering from overseas. This includes Korean and foreign nationals who do not have a residence where they can safely self-isolation. Any individual admins must self-isolation in a single room and not exit the room for 14 days. 6 to community treatment center, temporary living facility open. About 10 such facilities are still in operation. Third, are temporary testing facility, providing temporary residence for persons entering Korea open overseas as they wait for their COVID-19 test result. Each self-isolation room is disinfected before and after admission, and they are supplied with living essentials and special receptacles for the discharge of medical waste. 3 ready-made meals and 1 or 2 snacks per day are supplied to each room by the joint government support group that manage the operation of the self-isolation facilities. To check for symptoms, there is thermometer in each room every morning and afternoon. The isolation individuals are required to enter any symptom,
2 minutes
such
remaining.
as what?
2 minutes remaining.
Yes. Korea Environment Corporation is also involved in supporting medical waste management system abroad. For example, together with the Korea Environment International Corporation agents, we are engaged in on-site activities aiming to improve the medical waste management process in Paraguay. This project is intended to prevent secondary infection and advanced living conditions by improving the medical waste management process in Paraguay. It has several components. First, present conditions of medical waste management are surveyed to identify issues and make Paraguayan officials aware of potential improvement schedule. Second, Paraguay's law on medical waste management are reviewed to come up with guidelines and training that can be readily assessed by medical personnel. Finally, a hospital is selected for trial run and the medical waste storage facility improvement project is executed for the appropriate management and processing of medical waste. Also, in effort related to this project, waste management manual used in Korea for the COVID-19 response were translated and supplied to Paraguayan officials, strengthening international cooperation. This concludes my presentation on Korea's medical waste management response to COVID-19. I look forward to the Q&A session.
Thank you, Dr. Kim, for your insightful presentation. And as governments around the world trying to respond to healthcare challenges associated with COVID-19, Korea's response is very useful. And as you mentioned, with the experience of MERS, Korea was able to respond very quickly and very carefully organized system that allows for safe, efficient, and effective collection and processing of healthcare waste. You mentioned different treatment facilities, and of course RFID system. And I wish we had more time to learn more from you, but as I mentioned, your PowerPoint will be uploaded after the webinar, and I think we will get a lot of questions. So let me now, in the interest of time, thank you, Dr. Kim, again. And in the interest of time, let me move on to our next speaker. Our next speaker is Xiaofang Zhou. Xiaofang, you are joining us from all the way from New York. So, and we heard about Korea's efforts on healthcare waste management and so far. So can you share with us your thoughts on the challenges and opportunities from a global perspective, along with the role of UNDP within this context? So over to you, Xiaofang.
Thank you so much. Can you hear me?
Yes.
Okay, thank you. Hello, everyone. It's my great pleasure to join this webinar to share the views with other colleagues and participants on the healthcare waste management. In the chemical and waste team of UNDP, we managed a portfolio in about 20 countries on the medical waste management, and we're working together with other team of UNDP like HIV team and the procurement team. We also work together with other agencies like WHO and civil society, the healthcare waste without harm, and experts in this area for a long time. So COVID-19 pandemic is an unprecedented challenge to the world. And we are still in the midst of the pandemic now and facing the great uncertainty for our future. And from the past 4 to 5 months, it's quite clear the health system in many nations has been overwhelmed, over the outbreak. And the capacities need to be improved to get through this current crisis and prepare for the future. And during the pandemic, infectious healthcare waste is rapidly increasing. Many nations now find themselves in their situation of mounting infectious medical waste, flooding the waste management capacity in the country. But well, in some countries, actually such capacity is not in place at all. And in some countries, maybe because lack of the training and the preparation, even there is capacity, but it was not used in full, it's, we have such kind of situations. We also have a concern that currently the massive use of the single-use plastic, such as those PPEs, which are very much needed in this situation for healthcare workers as well as citizens. But if without appropriate management, most of those plastic waste can add up in rivers, oceans, and jeopardize our great effort, in recent years to reduce the plastic pollution and protect the ocean. So in this situation, and we believe that government stakeholders and UN agencies need to work together to provide an urgent solution of the healthcare waste management through and beyond this pandemic. And as many government and agencies are very busy to provide immediate support to the health facilities such as PPEs, and we should not forget those, the workers on the medical waste. They put their life at risk. And I'm very happy that I just saw the photo from Korea, from the team, and their workers for transportation of the medical waste was well protected. They have very good protection for themselves. So we also think this is a good opportunity for public awareness and communication with stakeholders and people in this area. And healthcare workers, cleaners, those waste collector, they are very keen to know how to handle this infectious waste in a right way. So such as some kind of training and this kind of webinar will be very helpful to them. And apart from the threat of the COVID-19 in the short term, we think it's equally important to inform the people that inappropriate treatment to the healthcare waste can also generate the release of toxic chemicals, such as dioxin and mercury, which also have negative impact to human health and the ecosystem, and in particular to the women and through them to the future generations. So this means that the damage of healthcare waste to human health happens every day. And sound management of the healthcare waste is not a temporary problem in the pandemic. It's a long-term issue which needs systemic solution. I want to mention the Stockholm Convention on the Persistent Organic Pollutants, which was adopted in 2001 to deal with the emission and the release of some of the most toxic chemicals in our life. And to support this convention, and 15 years ago, UNDP led a global program to demonstrate and promote best technologies and practices to reduce and treat healthcare waste in 8 countries. And a global project team, including the colleagues from UNDP chemical team, health team, procurement team, WHO, civil society, and healthcare without harm, and were established to oversee the progress of this global program and solve those innumerable issues in the implementation, because we all know those tasks are sensitive and complex in the context of a poor baseline at that time in most of the countries. And achievement in the global program were remarkable. We accumulated a lot of experience. And you can see in the evaluation report that's already published. And I think at this time in the midst of the pandemic, there are many concerns of the country in Africa, because we know that healthcare system in that continent are not very strong. And we must say, it's actually very challenging to introduce the new technology or equipment, during the crisis due to many restrictions, and even without travel. And thanks to the tremendous work did by our international and national team and our partners in past 5 to 7 years, we have a regional program in Africa, including Ghana, Madagascar, Tanzania, and Zambia. That program were very successful in taking a comprehensive and integrated approach on the healthcare waste management, including the policy development, institutional strengthening, business model test, and technical guideline, equipment installation like those autoclaves, maintenance, and a lot of trainings. And that's really helpful. And we are happy now these capacities are helping the health facility in these countries to deal with the healthcare waste generated in the COVID-19 pandemic. And other countries like Colombia, Ecuador, Egypt, Pakistan, Kenya, Kyrgyzstan, Jordan, Lebanon, Vietnam, they also received support from the GEF through UNDP in this sector. But we know there are still a big gap in many countries, and we really need to strengthen the capacity in this pandemic. I think my key message here following 2 points. The first is sound management of healthcare waste needs a systemic change, regardless of the pandemic or not. Regardless of whether the country and the community are in the hotspot of the epidemic, the local government needs to assess the healthcare waste system and capacity and start to improve it. So as we all know, this takes time in building the capacity. And second, it's very important for the government and stakeholders to join the global network of healthcare waste management to get comprehensive guidance, knowledge and information, as well as technical assistance in order to ensure your healthcare waste management system is sound.
2 minutes remaining.
Yeah, I will finish very soon. And in the response to the COVID-19 pandemic, UNDP is now leading a global network across environment, development, and health agencies and regions. Coordinated work in this area provide technical support and help identify economic models and financial opportunities. So I would like to mention the continued support that has been provided by the GEF, as well as the Global Fund. And we are also in the process to develop a global knowledge management platform that can provide all necessary information and tools and can be used by the health facilities and stakeholders in scaling up your investment for sustainable healthcare waste system for all. I really hope all of the people could keep safe and we can get through this pandemic and begin the green recovery. Thank you.
Thank you, Xiaofang. This was very useful to hear about the challenges and opportunities on the healthcare waste management system. And you talked about the systemic nature of the issue, so it's not just during the pandemic time, but overall chemical waste management, which is a concern all year long. So it needs to be approached systematically. And you also mentioned the global network with knowledge management platform. I can't summarize each of the panelists' presentation, but yeah, I mean, really useful, and hopefully we can have good discussion during Q&A. Let me now move to Dr. Ute Pieper. Ute, Korea, of course, has an advantageous starting point with a well-established healthcare system. In contrast, with the limited fiscal and institutional capacity that developing countries have, what are their options for managing the pressure of COVID-19 on their ability to manage healthcare waste safely? Over to you.
Okay, so thank you very much for this introduction. Yeah, so I'm happy to talk here about healthcare waste management possibilities which have been elaborated by WHO and UNDP, and some guidance which are more focusing on developing and transition countries. So it was very interesting to see this presentation of the measurements in Korea, which is of course a very good example. So thank you very much for that. So like Chao-Fang already mentioned and highlighted, I think the global network is very important. So this is also something UNDP is setting up regular calls with UN organizations and donor organizations to discuss their approaches and to streamline as much as possible the ways of response, and so to talk with one tongue, so that we are all agreeing more or less on the same approaches. So what is an approach which has been agreed with more or less all of us, but especially with the UNDP and WHO, is that we first of all should conduct a rapid needs assessment of the COVID-related waste. So that means, so what kind of capacity is already there? What treatment capacity is there? Which knowledge is there? What kind of transport storage systems are already there and can be used, and maybe can be used much more. For example, when you have an incinerator or an autoclave and you use it 5 hours a day, you can use it maybe in shifts, so that you really use the full capacity of the treatment technology, which are already available. So this is the first step, so that you really know what do you have in your countries. So the next one is to include healthcare waste management in all the procurement plans. So this is also in line of the message Chao-Fang was saying. So it's, you know, we should take the chance now to establish a good, if it's only a basic one, but just to have a basic or even better healthcare waste management system established, where we can build up on, and then we can just get improved in the future. So for the short time, when we talk about procurement, it's about consumables, PPE, local production of hand sanitizers, and the midterm importation and installation of waste treatment systems. So that means, so in our experience, often the country's first thing they want to have, come on guys, buy incinerators for us. Yeah. So we need much more incinerators, but the first response should really be concentrated on the small things which we can do in a very fast time. And then we go for better and bigger installations. The next point is to strengthen the national capacity on healthcare waste management. So the organizations have healthcare waste management experts available, which can support the countries on knowledge, on capacity, and so on. The next one, facilitate technical support in policy, strategy, action plans development. So really to set up a proper healthcare waste management system also for the future, not only for this pandemic situation. And to promote clean solutions for healthcare waste management, especially regarding Stockholm Convention, using the best available technology whenever possible. So here we have some guidance which are readily available on the web from UNDP and WHO. So this one is the one from WHO. The last update was on the 23rd of April. So it's updated regularly, and it's about the water, sanitation, hygiene, and waste management for the COVID-19 virus. So there, all the different areas on WASH, including healthcare waste management, are captured and updated frequently. Also, a frequently asked questions document has been elaborated from UNDP, which is also currently updated. So the last version is, I think, from April. I have to look it up again. But so this is also available, and you will find in my last slide all the available basic documents which you can download. The other ones are like baseline reports and practical actions from WHO here, the safe management of waste from healthcare facilities. It's a really comprehensive guidance covering more or less all steps in healthcare waste management, which can answer most of your questions which you might have. And then there's a quite new one which has been issued last year. It's the overview of technologies for the treatment of infectious and sharp waste from healthcare facilities. So here this document is really providing practical guidance, what kind of treatment technology is available, what are the requirements of each of the technologies to really pinpoint the best technology for your situation. Then there are the WASH fit and WASH facility guidance, which are also used in a lot of countries now. Now I will just go a bit more into detail. So like I said, the frequently asked questions from UNDP, this has been developed by the team of the UNDP JEF project Africa in collaboration with UNDP, WHO and Healthcare Without Harm. So this frequently asked question document can be downloaded, and it is structured into 5 chapters. One is the community waste during COVID-19 outbreak from the community waste, then waste generated in the healthcare facilities. Then there's a specific chapter on the protection of waste handlers, which are often forgotten in all the discussions. So then we have a short section on waste transportation and technologies, including green options. Here the last update was the 26th of May, but it is currently under revision, so there will be a new one coming up very soon. Then the interim guidance from WHO is calling for establishing the already existing segregation systems in the hospitals. So the waste from COVID-19 patients is considered as normal infectious waste. It's not considered as highly infectious waste like it was during the Ebola outbreak. So WHO is really following the approach, just do the work like it should be done anyway, so standardize. So the segregation at the place of generation. So segregate infectious waste and general waste and sharp waste, the collection in leak-proof strong plastic bags and containers, the safe transport and storage, and treatment preferable in accordance with the best available technologies, and the safe disposal. So the last update of this document was the 23rd of April. When you talk about treatment, so this is something what often comes up in the discussions. So how can we treat the waste? So of course, like all UN organizations, we are calling to follow the Stockholm Convention. So that means to use best available technologies, like low heat processes or dual chamber incineration, high temperature incineration with flue gas treatment whenever possible. So these are more the incinerators which can be used centrally. If this is not possible, you go for the interim treatment solutions like dual chamber incineration, single chamber, or automated pressure pulsing gravity autoclaves. In low resource settings or emergency settings, transitional methods can be used, of course. Everything is better than nothing, that's for sure. Yeah. But however, we should have efforts to incrementally improve healthcare waste management and engage in multi-sectoral efforts to strengthen the system change. So we need to go towards a better system also in the future and not just look for this pandemic situation at the moment. Then also prepare for extra waste generation. So using more PPEs means more volume of waste and also more volume of infectious waste. So, however, the waste generated in waiting areas and healthcare facilities or at home during home-based quarantine is classified in accordance to WHO as non-hazardous waste and should be packed in black bags and closed properly before disposal by the municipal waste service. So it is important to assess the existing waste treatment capacity as the volume of waste during an outbreak will increase and additional treatment capacity might be needed. So again, during this initial assessment, there should be also looked at treatment capacity, which can be increased by using it more intensively.
2 minutes remaining.
Okay, thank you. I'm almost through. So the lessons learned, so I just brought some pictures during the Ebola outbreak. So here, equipment was purchased very fast. So they just put everything on the market and installed it very, very quickly. But like you can see here, these are pictures from Liberia, for example. It's just not used, it's broken. It's just didn't really was anything of sustainable activities to go too fast. These things need to be planned properly and installed and monitored properly. So this is an example from Ghana. So after the COVID outbreak, they responded with a new project, and this is how they did it. So they had a short-term and medium-term intervention. In the short term, there were technical support. So that means also training and providing information to the government and support the facilities, the regulatory authorities to conduct monitoring activities. The support of local production of hand sanitizers. So there's a good guideline from WHO to produce local-made hand sanitizers, which is very, very affordable. And the procurement of consumables and PPEs. And only in the medium-term intervention, properly planned, the importation and installation of autoclave and treatment systems. So here are relevant informations. All the documents can be downloaded, and I think it's a good source of information for countries which might have not the chance, like Korea, to set up a state-of-the-art system. Thank you very much for listening.
Thank you. It was very useful to hear from you in terms of first response, in terms of the key documents that you have shared, which are it's going to be available on the PowerPoint, and also the capacity needs assessment and the building of capacity. I think we should, in looking at the time, thank you again to all the speakers. Actually, it was so useful to discuss this technical but very important topic within a short time. Is always a challenge. I hope the audience got a kind of a glimpse of the work that's happening, and we got examples of different countries. So let me just move to the Q&A session now. We have selected a few questions from the chat box to ask our speakers, but I would like to really encourage for the audience to keep asking questions, some writing on chat box. I do see there are some exchanges already happening within the participants who are discussing among themselves, which is great to see. We do appreciate your questions, and we will pass your questions along along with their contact details to our esteemed speakers. So let me quickly move to the first question. So I would suggest 2 minutes for response, so we can ask more questions. So Dr. Kim, the first question is for you. The question that we selected is, having been on the ground at government quarantine facilities, can you describe any specific implementation challenges in medical waste management and how they were overcome? Over to you, Dr. Kim. I think it, yeah, unmuted, yeah.
Repeat. The first problem was medical waste discharge. People were directed were reluctant to discharge their waste into a medical waste container, which resulted in waste that was poorly packed for collection. To solve these problems, announcement was made continuously, and distribution of information continued in the government quarantine facility. The second challenge was securing collection staff. We had a difficult time hiring people due to fears related to the disease. To ensure safety, non-face-to-face collection system was applied so that the quarantined people and the collection personnel in the facility did not come into direct contact. Of course, there are still risks related to people collecting medical waste. This is why a proper personal protective equipment is provided to the collection personnel and in the discharge stage. Also, double seal packing is used to minimize the risk of infection. In the future, the government plans to develop a logistics robot for collection high-risk waste at the national level. Thank you.
Thank you, Dr. Kim. Next question I would like to ask Xiaofeng. What are the first steps developing countries should take to rapidly accommodate the sudden increase of healthcare waste due to COVID-19?
I would say some kind of assessment to the capacity, whether the capacity is in place or not, and what's the capacity. And there is a lot of assessment. I think in the pandemic, it's special. It's not like a normal situation. And you should assume that those waste generated per day could be even 5 times, even 10 times than usually. So you need to prepare for some measures that could be temporarily store those waste, and to try to deal with that. You maybe need more people to work on that, and you need to have additional people than usual to handle that. Something like that, you need to first, I think, assess the capacity and set up the team to deal with that. And then you need to monitor the process to ensure those procedures are properly implemented. But I think now, maybe at the same time, the government, based on the assessment, need to think about the plan and how to improve that capacity beyond the pandemic. I think Uto maybe could say more. I think this is my understanding. The first step would be assessment.
Yeah, right. So I just agree with you. So I think the assessment and to have again, to really to use the existing capacity as much as possible. Infectious waste should not be stored too long. So we need to see that the waste is treated after 1 or 2 days, depending on the weather conditions and your national legislation, of course. So just really try to use the existing capacities and very intensively, 7 days with 3 shifts, night and day, however, to capture the extended volume of infectious waste.
Thank you, Ute. Thank you, Xiaofeng. Next question I wanted to address to Ute. Okay, the question is, in some developing countries, informal workers are a significant part of the waste management system. how can we ensure their safety as they process potentially contaminated waste from quarantine facilities and from patients in isolation at home?
Yeah, that's a big problem, yes, because in a lot of guidance is then saying, okay, you should put it on a sanitary landfill. But sanitary landfills in the countries I'm working are not existent. So that means there are scavengers. The waste is not always collected by the municipality with staff wearing PPE, proper PPE, but from people in the streets searching for recyclables. So this is why, you know, when you are in home quarantine, for example, and you have like masks, and you want not that they get reused, so you have the possibility to destroy them before you dispose them, so that they cannot be reused, as well as really package the waste properly and close the bags properly so that the scavengers, you might also mark them and say, okay, this is waste from COVID quarantine, so that the people who are collecting the waste informally are also informed not to open this bags. So there's not a perfect system in that. So but just try to inform the people in the streets on what is happening at home.
Thank you, Ute. I'm seeing a lot of good questions on the chat box, but I'm also very happy to see that there's engagement happening among the participants. So I would like to thank all the participants and the colleagues who are answering questions to each other. So this is really good because that is kind of the idea for 1 hour short webinar. I do want to thank all the panelists for your sharing your experiences and reflections on the health and environmental challenges that healthcare waste poses in the context of COVID-19. We will. I guess we had about close to 100 people joining from all over the world. We will share the numbers of people who have joined on when we update the PowerPoints in our website. It's really good to see all this participation and engagement on this technical topic, but it's such an important topic. And as we found out that there will be a lot of follow-up questions to us after this webinar based on our previous experience. So we do look forward to feedback from everyone who took the time to join in today. So it's now time to wrap up. So once again, let me repeat that this webinar has been recorded and it will be made available to everyone externally, and PowerPoints will be uploaded in our website. I hope that you all have a wonderful weekend. Thank you for joining. Some of us it's evening on Friday, some of us morning, but we hope we have a good and safe and healthy weekend. So I would like to give the floor now to our director for a brief closing. The floor is yours, Stefan.
Yeah, thank you so much, Savat. I think this was really inspiring. I mean, I'm not an expert in this topic, but what was really clear is that what Korea is doing is very important. It's a point of reference for other countries. Really good to have colleagues from UNDP and Ute Pipa with us to get this kind of global experience. So let me just thank again at the end Dr. Yon, Dr. Lee, Dr. Kim for your presentation, and Ms. Park from the Korean Environment Corporation. This cooperation with you was really very important to us because we rely on your input. So thank you so much. Xiaofang, thank you so much for your early contribution from New York, and Ute Pipa for your contribution from Berlin. And last but not least, great preparation by Savat and the whole team. Thank you so much to you. And we saw so many good questions and comments from participants. That's my final thank to all participants for joining us from so many countries. I wish you all the best and have a nice weekend and stay safe.